The number one question I get on my social media, without a doubt, is this: how can I get bigger? How can I get longer? Or how can I get more girth? Today, we're going to tackle those questions head on and look at the actual evidence behind penile lengthening treatments. I'm Dr. Reena Malik, a urologist, and I've reviewed the research so you don't have to wade through endless myths online. A survey of 50,000 heterosexual men revealed something interesting. Over half, about 55%, said they were unhappy with the way their penis looked. But when the researchers asked their female partners, an overwhelming 85% of women reported being satisfied with their partner's appearance. So clearly there's a big gap between perception and reality. And while your partner's opinion matters, what often matters most is how you feel about yourself. Unfortunately, pornography and media have blurred the lines of what's considered normal, and it's easy for men to compare themselves to unrealistic standards. In a previous video, I discussed average penile size, and based on aggregated data, the average erect length is about 5.2 inches or 30. Normal variation extends within roughly 2.5 standard deviations from that average, so a penis can be slightly larger or smaller and still be considered within the normal range. The only measurement officially classified as abnormally short is under 2.9 inches or 7.5 centimeters in length. This is known as micropenis, which is extremely rare, affecting only about 0.14% of the population. Micropenis can be caused by congenital or hormonal abnormalities, certain surgeries, or cancer. But today we're focusing on men who fall within the normal range and still wish they were bigger. While the majority of men who are concerned about their size actually have measurements that are perfectly normal, the distress they feel is real. This type of concern can be classified as a form of body dysmorphic disorder, more specifically something known as small penis anxiety. And to be clear, having this anxiety doesn't necessarily mean the penis is small. It means there's a persistent preoccupation with the belief that it's not long or large enough. Clinically, it's defined as thinking about this for more than an hour a day, to the point where it interferes with daily activities. In severe cases, this can lead to hospitalization or even suicidal thought. That's why I say this isn't just about vanity, it's a mental health issue that can have serious consequences. Another danger is the internet itself. A quick search for how to make my penis longer will produce an avalanche of questionable websites and non-medical advice. Some men even travel abroad to undergo procedures from unlicensed providers, which can result in devastating complications. So please, if you're thinking about pursuing treatment, start with a reputable urologist or psychologist. Before we go any further, I want to share an important disclaimer from the Sexual Medicine Society of North America. Procedures for penile lengthening or girth enhancement are not recommended for men with normal anatomy. These are considered experimental and should only be performed in cases of micropenis or in the context of carefully monitored research. I don't personally perform these procedures in my practice, but I have researched the available data so we can talk about what's out there. Treatments fall into two categories: non-surgical and surgical, and we'll start with the non-surgical side. The first is psychological counseling, which might sound unrelated to size, but it's incredibly effective. Validated questionnaires and educational counseling can help you understand what normal size actually is and address the anxiety that comes from unrealistic expectations. Studies show that most men who go through counseling alone often lose the desire for any surgical or device-based intervention. That's a powerful result without a single medical risk. Next are devices and methods marketed for physical enlargement. Three come up most often: penile extenders, vacuum erection devices, and injectable treatment. Of these, only penile extenders have credible evidence showing they can actually increase length. These devices work by holding the penis in place with a loop or ring at the head, connected to adjustable rods that apply consistent traction over hours each day. Over months, this traction stimulates tissue adaptation and measurable length gain can occur. In urology, we measure penile length in two ways: flaccid length and flaccid stretch length, with the latter being a good predictor of erect size. In men who use extenders consistently, meaning multiple hours a day for several months, the gain tends to be around 2 centimeters, which is less than an inch. It's small, but it's real. However, compliance is key, and some men experience side effects like numbness or bruising. Vacuum erection devices, on the other hand, can improve erectile rigidity and blood flow, but have shown no lasting effect on length. As for injectable substances, whether it's fillers, oils, or other compounds, the risks far outweigh any potential benefit. Complications can include scarring, deformity, erectile dysfunction, and infections, some of which have been reported decades after the injection. In short, please do not inject anything into your penis outside of an approved clinical trial. Surgical options are where the stakes and the risks get even higher. One of the most common procedures is a suspensory ligament release, where the ligament connecting the penis to the pubic bone is cut to allow more of the shaft to hang outside the body. While this can give the appearance of extra length when flaccid, it doesn't increase erect size and comes with complications, including instability during intercourse. Other surgical attempts have included skin grafts, tissue flaps, or even reb cartilage implants, but these methods generally produce inconsistent results, high complication rates, and low patient satisfaction. Studies on these surgeries are often poorly reported, with small sample sizes and inadequate follow-up, making it impossible to draw reliable conclusions. For these reasons, routine surgery for penile lengthening is not recommended unless it's part of a clinical trial. A legitimate clinical trial takes place under the oversight of an institutional review board, or IRB, which ensures that the procedure is ethical, that patients are monitored for complications, and that all outcomes, good or bad, are documented. This kind of rigorous data collection is essential for determining whether a procedure is truly safe and effective. The bottom line is that there's very little you can do to significantly change the length you were born with, and that's okay. Penile traction therapy with an extender can give a small but measurable increase if you are extremely consistent, but most other methods either lack evidence or carry serious risk. If concerns about size are affecting your self-esteem or relationships, the safest and most effective first step is working with a psychologist or sexual health counselor. Addressing the anxiety itself not only protects you from irreversible harm, but often restores confidence without a single surgical incision. In the end, chasing dangerous or unproven methods can leave you worse off than when you started, with a penis that is scarred, less functional, or permanently damaged. Take care of yourself, value your overall health, and remember that satisfaction is not just about measurements, it's about confidence, intimacy, and connection. And because you're worth it, always choose the path that protects both your body and your peace of mind.